Welcome to Facts TV News, where everything is true.
Send him home, please. February 26 was the last time relatives of 65-year-old Clyde Taylor saw or heard from him. This has been the longest that they have not been in touch with him, and it has been an antagonizing wait for news of his whereabouts. Taylor is the manager of the Fisherman's Point Resort in Ocho Rios. His sister, Vannie Taylor, the resort's manager director and chairman for the Ocho Rios Runaway Bay chapter of the Jamaica Hotel and Tourism Association. Everybody is in shock. None of us expected something like this to ever happen. The strange thing also is that we can't find his car, and all calls to his cell phones have gone unanswered. The more time passes, we get worried because with all that is going on in Jamaica right now, we have to be worried, the youngest daughter, Clyde Taylor, reported. Even if my dad goes out at night, he would come home, or if something comes up, he would call to let us know what was happening. He always answers his phone, and if he doesn't, he always calls back, she added. The 31-year-old said the family is not aware of any medical condition which would cause her dad to stray. The only thing he has is high blood pressure, and he has it under control, so I don't think there is any sort of illness affecting him, she said. Before leaving his home in Salem Runaway Bay, Clyde appeared to have perfectly fine, according to Shamara. He told his sister Vannie that he was heading out for a few hours. He was wearing a striped blue and orange long-sleeve shirt and blue jeans. My aunt saw him and he said he was going to Ochi to do something. She asked if he was coming back and he said, more than likely, Shamara reported. As he usually does, Taylor checked in with the resort a few hours after leaving home. He called and spoke with one of his employees. He usually checks in on whoever is on the last shift, and he told her he was in Ocho Rios, but he wasn't sure if he was going to stop by the hotel. So based on what we know, that was his last conversation, Shamara said. The distraught family is hoping for Taylor's safe return. Even if somebody rob him, they can take whatever they want, but just send him home, please. We just desperately need him to come back home, his daughter Shamara pleaded. Son dies days after making plans to visit mother. It was a conversation unlike any they had enjoyed in few weeks, so Berlin Black Harley and her son Ryan Parry were eager, after they spoke on February 23rd, to spend time with each other. Parry promised to visit her 3 days later at her home in Boghole, Clarendon. He never made it. A day after they spoke, he died in a car crash along the Discovery Main Road in St. Anne. Me frightened to hear that Thursday morning that he died. It's sad to think that he was coming to see me and he will never show up. Only who feels it knows it, because I'll know I haven't eaten and I just can't control my tears, Black Hartley stated. The plan was that when him come this Saturday, we would kill a pig and cook, and he was also going to bring some down to where he lived, she added. Parry died along with his children's mother, 40-year-old Karen Fergan, while their 11-year-old son, Jabari, is among those who received treatment at hospital. Reports are that they were among 5 people traveling towards Discovery Bay when the vehicle they were in allegedly overtook a line of traffic and collided with a silver Mercedes. The resulting crash took place about 8 a.m. When me just heard the news, me hear that my grandson had died, but me thank God he's still alive. Myself and my daughter will have to take him and take the best care of him, said Black Hartley. The 57-year-old said she shared a tight-knitted relationship with her son, and his death has been a hard blow. She recalled the great times they shared while spending time at Parry's house in Runaway Bay, St. Anne. Me and my son share a good relationship. I was at his house for a year, and I tell you that anything me ask him to do, him get it done. I never call that child and don't get him. Right now it feel like one of my hand cut off, because he was one I could depend on for any little thing, like for money or so, she said. I never have a dull moment with him. Black artist said that as he was relying on God to ease her burden. I have to just pray and ask God to carry me through, and every morning I do my devotion, she said. Neighbors pitch in to help partially blind elderly man. 82-year-old Lawson Brown will be able to sleep better at night knowing that his basic needs are covered thanks to the kindness of neighbors and a businessman who rallied to help. The partially blind senior citizen has been living on his own since his wife died 4 years ago at their home in Effortville. He is unable to fend for himself as his frail frame cannot stand up to rigorous activities. The slightest obstacle at times appears insurmountable. Sometime when me bought me to it burn me bad and me can't even sleep at night, lamented the senior citizen as he struggled to find the right words to convey the extent of his plight. Me having a rough time, especially since she died, because I can't really manage to look after something to eat, so I go to bed hungry sometimes. Life is very hard with me. Born and raised in Manchester, Brown said in his 30s he moved to Clarendon, where he made a life for himself. He has 6 children and has no idea where they are today. He has no known illness, but time has taken a toll on his body. I spent 5 weeks in the hospital last year because my feet wouldn't stop hurting me. But all now, the doctor don't tell me what happened to them and it still pain me. Sometimes at night, when me fi sleep, I just pain under my foot bottom. Them under me toe them, he said. He wants to go back to the doctor but doesn't have the money. His suffering has not gone unnoticed. It has now become too much to bear for community members Owen Mitchell, who was spurred to action as he is no longer able to watch the elderly man suffer. We know him for a good while now. He used to be a mason back in the days when he was younger and could manage himself, Mitchell explained, adding that he had long admired Brown. But him get old now, and since his partner died some years ago, we realized he must suffer. So we put on a small cookout called Blue Rave and decided we had to do something for him from that because nobody not around to look after him like that. It breaks his heart that none of the elderly man's family members are around. It look away because although he has family over time, realize nobody come to visit him. No matter what caused them to fall out, somebody should be there to look out for him and give him something every week or every other week. No matter what had happened down the line, put that behind and watch the past. Do a little what you can do and when you can, Mitchell urged. He said a neighbor identified only as Miss Winsome has been given bone meals whenever possible. Things are expected to get a bit easier, however, now that the proprietor of the stoplight wholesale in Maypen, Junior Wilson, has promised to provide groceries for the senior citizen. When I learned of the situation, I decided to assist because he's an elderly man who lives all by himself and relies on the kindness of other people to survive. It's a privilege to be able to help in this way. The type of business I run, people support me, so that makes it easy for me to give back and that gives me a good sense of satisfaction, Wilson said. Like Mitchell, he is hoping Bourne's family will find their way back into his life and help him. The man's plight, he said, is a cautionary tale. We all make mistakes, but there comes a point in life when you have to think about how you will manage when you get older. Some people just live for the moment as if there is no tomorrow, but there is always a tomorrow. Sometimes you look after your children when you are young, but that doesn't mean they are going to do the same for you when you get old. You have to think for yourself. You must ensure you have some form of safety net to fall back on, said Wilson. Bond will be provided with groceries and toiletries fortnightly for the next 6 months, and according to Wilson and Mitchell, the assistance will continue if needed. Both men hope their good deed will encourage others to help others in need. As a small promoter, if I can do this and assist someone, the bigger promoters can do something like this too. Persons in their communities are suffering, so they need to look and see what is taking place and try to help even one person in that community. In every community, there is an elder who needs someone to take care of them, and I believe if each one help one, that will make a difference, Mitchell said. He also lauded Miss Winsome, who, he said, has in the past supplied Brown with meals from her own limited means. He hopes she will continue to cook his meals with the groceries provided by Wilson. The grocery store owner added his appeal for more Good Samaritans to come forward. I always encourage other business persons to assist others where they can because there are persons who are less fortunate, and I will always have some type of need, and COVID-19 has made it even worse for some persons to survive, Wilson stated. SVF donates 4 oxygen concentrators to the University Hospital of the West Indies. The Supreme Ventures Foundation, SVF, has reaffirmed its commitment to the national health with a donation of 4 oxygen concentrators to the University Hospital of the West Indies UHWI. The machines will assist the medical staff in providing adequate oxygen for patients who have difficulties breathing due to conditions like asthma, lung cancer, chronic obstructive pulmonary disease, and the novel coronavirus. According to UHWI consultant Dr. Philip Barrow, the donation will improve the hospital oxygen services. He was speaking at the handover ceremony last week. We are very grateful to Supreme Ventures for this donation. Oxygen concentrators will be a significant addition to our arsenal. They provide an unlimited supply of oxygen that's completely independent of any outside source, so it is a welcome addition to this resource, said Dr. Barrows. In the meantime, SVF Director Heather Golson said the foundation will continue working with medical facilities to provide the necessary support to the country's health system as it grapples with the impact of the novel coronavirus pandemic. We are always happy to support our doctors and nurses who are currently facing an unprecedented challenge. These oxygen concentrators will be an asset to the medical team and will play a major role in saving so many lives. We look forward to continuing this work as the year continues, said Golson. The UHWI has been the recipient of a number of donations from the SVF in recent times. Last year, the foundation donated approximately $15 million to the neonatal intensive care unit and a mobile ultrasound machine to the diagnostic department. The foundation also donated $4 million to the UHWI in 2018, which assisted in the purchase of a portable echocardiogram machine. Jamaica remains committed to its environmental protection targets, says Samuda. Minister without portfolio in the Ministry of Economic Growth and Job Creation, Senator Matty Samuda on Tuesday addressed the resumed fifth session of the United Nations Environmental Assembly now underway in Kenya. According to a release, Minister Samuda in his remarks acknowledged the work of the UN Environment Programme. He noted that, given the global plastic crisis, the government of Jamaica supports a proposal through UNEA 5.2 to establish an Intergovernmental Negotiating Committee (INC) on plastics to guide and coordinate the implementation of UNEA resolutions in place since 2014. This, the minister said, clearly sends a signal that Jamaica will build on its efforts to reduce plastic pollution under the phase ban on single-use plastics, which commenced in 2019, and will continue to work with the multilateral community to deal with the source of plastic waste definitely. Samuda also told the UNEA session that Jamaica remains committed to its target for environmental protection. In December 2020, Jamaica and 13 other countries announced their commitment to a new global ocean action agenda which seeks to achieve 100% sustainable ocean management of areas within natural jurisdiction guided by sustainable ocean plans by 2025 and to support a global target to protect 30% of the ocean by 2030, he stated. Among the country's international biodiversity and blue economy commitments, he said, is the declaration of a section of the Pedro Bank as a protected area, which is expected to be accomplished this year. The area comprises approximately 882 square kilometers and contains significant biodiversity. Approximately 18.1% of terrestrial and 13% of marine areas will be under legal protection, Samuda added. Samuda further noted that Jamaica is also actively engaged in restoration programs for key several marines and coastal ecosystems, including mangrove forests, seagrass beds, and coral reefs. He acknowledged the support Jamaica has received from its international partners for its ambitious environmental goals and stated that post-COVID-19, all governments must, through partnership, chart a course of action that recognizes nature at the heart of sustainable development. While we collectively continue to grapple with the effects of COVID-19 pandemic, we should also be mindful of the opportunities presented to make a transformative paradigm shift from unsustainable production and consumption patterns to one that embraces the circular, green and blue economies. UNEA 5.2 serves as a platform for delegates from countries around the world to gain consensus on multilateral environment efforts surrounding biodiversity, climate, pollution and food systems, among others. Samuda is expected to deliver a statement on March 4 on the occasion of the special session to commemorate the 50th anniversary of the creation of the United Nations Environment Program.
Please remember to subscribe, like, share, and click the notification bell for daily updates.